Thank you, Mr. Council President. I'm honored to be joined by my colleagues on the HHS committee, Councilmembers Rice and Glass, to acknowledge this important day, National World AIDS Day. And I was reflecting almost 25 years ago, I did an internship with an organization called Casa Alianza in Mexico City. And one of my first assignments during that internship was to support a social worker whose task was finding the mother of a 16-year-old girl who was dying of AIDS and who had a 18-month-old baby girl who was HIV positive. And it took us more than a month to track the mother down because she lived in a shanty town on the outskirts of Mexico City. And I will never forget the look of relief on her face when we let her know that her daughter was alive, but then the look of despair and just complete and total shock and sadness at the news that she was dying. And then we had to explain what AIDS was to her because this was in the 90s. So many families and so many people across the country over the last 30 years have been devastated by the AIDS virus. And while we have made tremendous strides, it continues to disproportionately impact so many of our communities, many of the same communities that have been impacted by the pandemic. And so today is an important day to recognize the accomplishments, but there is still so much more work that needs to be done. And so I will invite in a moment my colleagues, Councilmember Rice, followed by Councilmember Glass, to make some opening comments. We will then hear from Dr. Travis Gales, our public health officer, who has been a leader in this space for a number of years. And I would also like to acknowledge in the audience is Emily Brown and Melvin Cawthon, representing the DHHS Public Health Services HIV team. And I'd like to announce that in the upcoming year, the HHS committee will be hosting a committee session to discuss the progress that the county has made and what work still needs to be done to continue to move us forward in addressing this devastating virus. So with that, I'd now like to turn it over to my colleague and friend, Councilmember Rice, to say a few words.
Well, thank you very much, Mr. Chair. And I'd first like to thank Dr. Gales as well as Mr. Cawthon and Ms. Brown for hosting the HIV in Montgomery County forum today that I think is going to be from 1 o'clock to 2 o'clock. Don't want to steal your thunder there, but certainly want to applaud the great work that you're doing in terms of making sure that folks understand that we can't forget about this horrible disease. It's oftentimes, and we see it, unfortunately, that it's only when these diseases afflict famous people, people that we know, that folks want to rally around and talk about it. And I remember being a child and learning about Magic Johnson being HIV positive, and all of us in the Black community saying, well, he's dead, and seeing him today continues to remind those of us who remember when he first got that diagnosis about how far we have come when it comes to addressing the HIV and AIDS crisis. Then it was a concrete death sentence, and there was no question that there was no light at the end of the tunnel. And it's something that we've seen really has propelled across the world. I harken back to my time when I traveled to Gondar, Ethiopia, a little over a year ago, and was talking to them about some of the health challenges. And even in a remote area like Gondar, a small area that's a suburb of Addis Ababa, Ethiopia, it's one in which even there, they've been able to get a handle on the crisis. And it says something. It says something about how health policy and the great work of health officials can actually turn the tide, something in which we're looking for right now when it comes to our global pandemic with the COVID crisis. And so there's hope, just as there is now plenty of hope for those who have managed their condition, being HIV positive, even those who have full-blown AIDS. The number of viral treatments that are out there have continued to grow and expand and become even more successful. And it's due to the great work of health professionals. And so I really want to thank the health professionals today for their work in saving people's lives across the globe. Thank you very much, Mr. Albornoz.
Thank you, Councilmember Rice. Councilmember Glass.
Thank you very much, Chairman Albornoz and Councilmember Rice, for collectively helping put a spotlight on World AIDS Day. And this year, we've been navigating our way through a global pandemic. And we know firsthand the challenges that a mass public health crisis is and the effects it has on not only our local community, but a global community. And just like COVID-19, we know that everyone in our community is at risk, but that information does not reach everybody equally. And it is our most vulnerable communities that are worst hit, not only by COVID-19, but with the lingering effects, the perception and the stigma. And the same is true for HIV and AIDS as well. And the LGBTQ plus community knows this and has known it for a very long time and has been disproportionately affected by HIV and AIDS due to a lot of the systemic inequities that exist. And some of those inequities, include non-inclusive sex education in high school. And according to the Centers for Disease Control, over half of the people in the United States with HIV are gay or bisexual men. And from conversations that I've had here in Montgomery County within our own community, I know firsthand how many members of the LGBTQ plus community, particularly our seniors, have been discriminated against, not only for their sexual orientation or gender identity, but because of their HIV status, which is why I introduced the LGBTQ Bill of Rights, and I'm so proud of this entire council for unanimously supporting that piece of legislation, which is the first in the region to incorporate HIV and AIDS in our anti-discrimination protections. And so again, I'm just so proud of the work that we are doing, not only as lawmakers, but our county government as well, and our healthcare providers and our organizational leaders. And so with that, we know that there is a lot more work to be done. And the theme of this year's World AIDS Day, resilience and impact, those are two principles that guide me in the work that I do here. And I know that it is the same principles that guide all of us. And so that we will continue making sure that our residents are safe and protected here at home with the information and with the health care that they need.
Thank you so much, Councilmember Glass. Well said, both of you. I'd now like to invite Dr. Gales to say a few words as well. And upon completion of those words, we will read the proclamation. Dr. Gales.
Good morning. Thank you to the full council and Councilmember Albornoz, chair of the committee, and Councilmember Rice and Councilmember Glass. You've said a mouthful already. There's not much else left to say, but thank you for the opportunity and recognition of today's date. We do celebrate the work and advances that you all referenced, including the many biomedical advances that have been put into play that have extended life for many folks and has removed the death sentence mentality, if you will, from how we designate HIV to the biomedical preventative methods that are in place now that are for individuals who are HIV negative to prevent them from becoming HIV positive. We also celebrate the great accomplishments as reference to Councilmember Rice and Councilmember Albornoz's comments in terms of decreasing maternal transmission to practically zero across, in particular in the United States and many other countries. We also celebrate the new potential advances in treatment to cure types of modalities, as well as improving not only the quality of the antiretrovirals in place, but also the different mechanisms of delivery to increase adherence and remove those barriers to ensure folks are adherent to their regimens and are achieving undetectable status. But at the same time, we also recognize that there are significant challenges that you all have laid out already, including the continued influence of social determinants of health on an individual living with HIV's ability to be successful in achieving undetectable status and having access and linkage to care and linkage to support services for their lives to be successful, as well as removing removing those same barriers and obstacles that predispose certain folks to having an increased risk of HIV acquisition. We know that we have to continue to work on addressing those social issues and those social obstacles and the social realities of many folks, as again you all have referenced, that put them at greater risk, whether it's systemic racism, access to housing, access to fair and equitable jobs and economic opportunities, decreasing stigma, so on and so forth. And because of those continued challenges and obstacles that underscore the need for continued work, we are excited to build on the work that has existed in the county for many years before today, as well as moving forward, being a part of the CDC's Ending the HIV Epidemic platform that will work to identify as many residents as possible. So getting to a level where we've achieved at least 90% of our residents who are HIV positive knowing their status, 90% of persons living with HIV to have reached an undetectable status, 90% of folks living with HIV linked to care, and a 50% reduction in new cases over the next several years. And the last thing I would point out is for many folks, historically, Montgomery County has not been included in many of those conversations related to HIV reduction in comparison to some of our peer jurisdictions. We do have HIV here, and it's important that we continue to work to bolster and increase the support services that we have for residents living here with HIV. We have a great team in place, and we have just two of the many members of the team in place here in the county, as I mentioned, who've been doing the work for many years before today and will undoubtedly continue to lead the effort moving forward. Thank you.
Thank you, Dr. Gales. Important message, and again, extraordinarily well said. All right, can I get a thumbs up? Do my colleagues have the proclamation before you? Because we're going to tag team this. All right, let's tag team. So without further ado, proclamation of the Montgomery County Council. Whereas World AIDS Day is dedicated to increasing awareness of the AIDS epidemic, which is spread by HIV, celebrating increased access to treatment and prevention and services. And whereas, Councilmember Rice?
Despite the recent improvements in treatment, it is estimated that more than 40 million people worldwide have died of AIDS since 1981, and more than 37 million people are living with HIV, claiming an estimated 2 million lives annually, of which more than 250,000 are children. And
whereas in Montgomery County, we have been designated as a priority jurisdiction for the federal public health initiative, Ending the HIV Epidemic, a plan for America. Because of the high infection rate and with more than 3,500 people living with HIV in our county. And
whereas Montgomery County's plan to end HIV aims to reduce new HIV infections by 90% in 10 years through expanded testing, connections to prevention tools and treatment, and fine-tuning our ability to respond to outbreaks. And
whereas Montgomery County's HIV epidemic shows serious disparities based on race, ethnicity, sexual orientation, and gender identity, especially across Black, Latino, and LGBTQ communities, making it vital to target our testing, prevention, and programs of care to address these important needs.
Now, therefore, be it resolved that the County Council of Montgomery County, Maryland hereby recognizes December 1st, 2020 as World AIDS Day. And be it further resolved that the County Council calls upon all its residents to help end the HIV epidemic by learning the facts and fighting the stigma and showing support, respect, and compassion for those living with HIV. Presented on this first day of December in the year 2020.
Thank you all. Mr. President, I yield back to you.
Thank you for a very, very fine presentation.